Hi everyone, my name is Angel, and my topic will be about a case study of lead poisoning, specifically children in the US. So, first and foremost, I'll briefly go through the context of what this case study is and explaining it in a more broader sense. Now, you're probably wondering, why do people use lead? Well, before people figured out the health risks, lead was one of the first metals humankind learned to use due to its ease of extraction and its ductility. It was perfect for water systems because it didn't rust like iron, and it was abundant and malleable, so it was perfect for cookware, plumbing, and cosmetics. Not supported by his colonialist actions, but in 1786, Franklin was one of the earliest voices to recognize the health hazards of lead, but it wasn't mainly focused on the issue on children until later on, when lead paint industries became aware of the dangerous side effects on children as they developed. We want to focus on children because they're the most sensitive group to toxins, and we do want to bring up an issue upon low-income racial minorities, as we see here in this statistical evidence. So you can see here in this data, in the year 1999 to 2000, the blood lead level for non-Hispanic black children compared to non-Hispanic white children. Moving on, again, we see that black children are suspected to be the most vulnerable and likely in low-income households. Many black children across the U.S. aren't given proper education and aren't aware about this. But yes, I know that inadequate fundings and lack of education can apply to all children. And it's important to reach out to local and state governments and outreach communities about this. One thing I think is a good outreach is putting up flyers like the picture shown on the right about how to protect children from lead. Basically showing the how, who, and what to initiate from this. Another idea pop up in my head is that organizations should do things where they do commercials. You probably heard of the Lil Lungs commercial about how smoking kills, things like that. I think that would be a great idea. So today, Rhode Island takes the lead in putting the effort to reduce lead poisoning incidents in children's childhood, partaking in the Childhood Lead Action Project. This organization basically focuses on the health of children's development and ensure they're getting proper diagnosis and treatment. And then in the SWOT analysis, the main organization's strength is educating for those non-English speaking immigrant families and getting many advocates to support for the lead poisoning cause, which I think education and awareness is the most crucial aspect. Unfortunately, this organization only focuses on Rhode Island's main cities, but with the opportunities and advocates collaborating with them, this can inspire other organizations across the states to do the same. I couldn't really find any threats to this, but organizations can sometimes run into disagreements and complications when it comes to policy changes with the legislators. Now, there are other various factors on how children can be exposed to lead, and mainly there are things that they consume, such as lead going into the water and fishes that contain lead and other stuff, chewing toys, and exposure around households. So there are ways of prevention, such as being attentive with what they eat. So it's best that they eat foods that can get rid of the lead out of their system, and they consume bananas, yogurt, and oranges, which are good for them. And then, if you ever heard of the news about lead going into your neighborhoods' pipes, you can check the plumbing system. And then if you want to use water in the sink or something, you can let the water run 3 to 5 minutes. Then also give your children blood tests, such as a finger stick test or a Venice test. And so I believe the trans-theoretical model of behavior change accurately represents how to prevent lead exposure in children. It's definitely leaning towards action and maintenance, because these are the steps to feel competent to overcome the barriers and use techniques to enhance the commitment. So from maintaining a healthy diet, washing toys, removing contaminated clothing, and then getting blood tests. So this is basically where families gradually adopt protective routines against lead exposure. And now here below we have two alternatives according to this article below. So the first intervention is basically to educate you and your child, and it has been proven to generally decrease the BLL due to awareness. And then another alternative is the additional one, which is dust or soil testing exposure assessments case finding and monitoring, though education seems to be proven more better because you're being taught how to look for cleaning services, evaluating your own home, etc. So now taking a look at the recommendations page. In the case study, it mentioned how the HUD Grant Services funds professionals for children with high risks of lead. And so my first recommendation is like how we should have bilingual professionals because this is essential for families of immigrants who don't speak English and who mostly live in low-income houses. And then another thing in the case study is like to implement a variety of cleanup and repair strategies. And so what they don't mention is that they didn't mention to fix poor areas first. So I think it is critical to know the cities with the highest population density with lead. And it says like in the study it will essentially decrease more than the higher income neighborhoods. And that compared to the higher income with the low income, the higher income neighborhoods essentially gets more resources and access to be aware of the lead poisoning. And then lastly, this one targets on screening programs at local fairs, health departments, doctors' offices, etc. And so I feel like they should offer screening at WIC sites and using blood testing instruments in clinical offices so that families wouldn't have to wait for lab test results and then they don't have to go anywhere else, which is pretty time consuming for them. Now, step 6, to establish an action plan. Unfortunately, there isn't enough research in low-income Black children and the exact causes of these racial disparities, and so we need more funding for the research that's targeted for these vulnerable populations. And so moving forward, I created these timeline steps to ensure that these are the critical steps to make changes moving forward. So to summarize these points, firstly, we should recognize and focus on the vulnerable groups like the low income, the Black community, immigrants, children, etc. And then we should lead organizations, educate and create awareness, like I mentioned earlier about an advertisement campaign about how smoking kills. And then for the last step is with creating policy changes. Lastly, I want to go ahead and mention about my learning process and research in putting this presentation together. And is that firstly, I'm glad I chose this topic to learn one of the most dangerous environmental factors and learning more in depth about the aspects of how lead is an important issue to public health. I'm also grateful to recognize that I don't have to worry about financial things when it comes to this and having to live in a lead-traced household and just becoming more aware of what other minority groups have to go through. So now moving on to the lead problems in America is that they're always caused by things leaching into the water, like I mentioned before about the pipes, but then this situation in Peru was similar to it about the leaching. So more context on this. This is basically in the small mountain town of La Arroya in 1997 where the smelting process contaminated many residents with lead, and this has leached into the water and this has toxicated the air and the soil. Later on, children have been showing symptoms of lead poisoning, and then so they were tested for lead in 2002. It was also seen that 99% of children who live in the area have blood levels exceeding acceptable amounts of lead, with the average being 3 times the World Health Organization's limit. And so this has led their grassroots group called the Movement for the Health of La Arroya. So this is where it has happened similarly in the case of study of how it has mentioned in the case of Flint, Michigan's is lead contamination in the water and having organizations and local communities and residents to fight for the cause. So this wraps up the case on lead poisoning and the milestones in public health. Here are my references, and thank you for watching.